They told you it was just old age. They told you that as long as your fasting glucose was okayish at your last checkup, you're in the clear. They lied. I'm Dr. Arthur Hayes. I've been practicing clinical medicine for over 30 years, and if there is one thing I've learned from seeing 30,000 patients, it's this. Your blood sugar doesn't just live in your blood, it lives in your feet. Most people think diabetes starts with a blood test. It doesn't. It starts with a whisper in your toes. Let me tell you about George. George was 68, a retired contractor, tough as nails. He came to see me for a routine physical, but I noticed he was limping. I asked him why. He said, "Oh, Artie, it's nothing. I think I've got a pebble in my shoe I can't shake out." I told George to take off his boots. There was no pebble. But there was a deep, dark ulcer on the ball of his foot that he couldn't even feel. George was 3 weeks away from an amputation, and he had no idea he was even diabetic. Today, I'm going to show you the 9 warning signs George missed. These are the truths that standard 10-minute HMO checkups often overlook. If you have even one of these, you need to pay attention, because your body is trying to save your life. The first sign is what I call the pins and needles ghost. You feel a tingling, like your foot has fallen asleep, but it won't wake up. Most of my patients say, "Dr. Hayes, I just sat on my leg wrong," or "I think my shoes are tied too tight." They think it's a circulation fluke. The medical reality is that this is peripheral neuropathy. When your blood sugar is chronically high, even at pre-diabetic levels, it begins to damage the delicate coating of your nerves, called the myelin sheath. Once that coating is gone, the nerve sends misfire signals to the brain. Think of your nerves like high-quality copper wiring in your home. Now, imagine pouring acid over those wires. The insulation melts. Pretty soon, the lights start flickering and sparks start flying. That tingling? Those are the sparks. According to the American Diabetes Association, roughly 50% of adults with diabetes will develop some form of nerve damage. The tragedy? Many of them have it for years before they are officially diagnosed. Starting tonight, perform the sensation sweep. Take a soft feather or a silk scarf and run it lightly over the soles of your feet with your eyes closed. If there are spots where you can't feel the touch, your nerves are under attack. The second sign is the stubborn scratch, a cut that won't quit. Patients tell me, "I must have scratched myself in the garden. I'm just a slow healer, always have been." In reality, diabetes does a double whammy on healing. First, it narrows the arteries, reducing blood flow. Second, it keeps your body in a state of high inflammation. Without fresh, oxygenated blood reaching the wound, the repair crew in your DNA can't get to the job site. Imagine a house fire. You call the fire department, but the water pipes are rusted shut, and the road to your house is blocked with debris. The fire just keeps burning. That is a diabetic foot ulcer. The CDC reports that foot complications are the leading cause of hospitalization for diabetics in the U.S. A simple scratch can turn into a systemic infection in less than 72 hours if your glucose isn't controlled. Never use wait and see for a foot wound. If a scratch hasn't significantly closed in 48 hours, you must treat it as a medical emergency. Use a mirror. You must treat it as a medical emergency. Use a mirror to check the bottom of your heels every single night before bed. Then we have the desert heel, or deep, painful cracks in your skin. People say, "It's just the dry air," or "I've been wearing sandals too much." This isn't just dry skin. It's autonomic neuropathy. This is when the nerves that control the oil and moisture glands in your feet stop working. Your skin loses its ability to stay supple, causing it to split open. Think of your skin like a leather glove. If you never oil that glove and leave it in the sun, it gets brittle. Eventually, it cracks. But unlike a glove, Those cracks in your skin are doorways for staph infections to enter your bloodstream. Research published by the Journal of Foot and Ankle Research shows that extreme skin dryness is one of the most common early signs of diabetes, often appearing years before a spike in A1C. Apply a thick, urea-based cream to your heels every night, but, and this is crucial, never put lotion between your toes. Moisture between the toes is a breeding ground for fungus. Now, before we move to the next sign, which is perhaps the most dangerous, I want to stop for a second. I'm telling you these things because your 10-minute doctor might not have the time to. I read every single comment on this channel because I care about this community. Are you noticing any of these signs? Even if it's just a little bit of tingling or dry skin. If you are committed to taking control of your health today, I want you to go down to the comments right now and type yes. Typing it is a contract with yourself. It means you're no longer ignoring the whispers. I'll be looking for those yes comments after the video. The fourth sign is the midnight fire. Your feet feel hot or burning, especially when you lay down at night. Patients usually say, "I've just been on my feet all day. They're tired." The medical reality is that this is the angry stage of nerve damage. As the nerves are being bathed in high-sugar blood, they become hyperexcitable. They are literally screaming. This is a massive whistleblower sign that your body is struggling to process carbohydrates. It's like the engine in your car. If you run it without enough oil, it starts to overheat. It's not broken yet, but it's running red hot. If you don't pull over, the engine is going to seize. The American Heart Association notes that burning feet can also be a sign of peripheral artery disease, which is highly common in people with blood sugar issues. Try a lukewarm foot soak with Epsom salts for 10 minutes. If the burning persists or wakes you up at night, ask your doctor for a monofilament test. It's a simple, cheap test that can save your legs. Number 5 is the puffy ankle, also known as edema. People assume, "I just had too much salt at dinner," or "it's just the heat." But diabetes damages the tiny capillaries, the smallest blood vessels in your body. When these vessels leak, fluid pools in the lowest point of your body, your ankles. This is also a major warning sign that your kidneys are being stressed by excess sugar. Imagine your circulatory system is a complex irrigation system. When the pipes get clogged with sugar syrup, the pressure builds up until the pipes start leaking into the surrounding soil, turning it into a swamp. The National Kidney Foundation states that 1 in 3 adults with diabetes has chronic kidney disease. Swelling in the feet is often the very first physical sign. Try the thumb test. Every afternoon, press your thumb firmly against your shin bone for 5 seconds. If a crater remains for more than a few seconds, you are retaining fluid. Reduce your processed carb intake immediately and see a specialist. The 6th sign is a change in the shape of your foot. Your toes might start to curl like claws, or your arch is collapsing. Patients say, "My mother had bunions. It's just genetics." The medical reality is that this could be Charcot foot. When nerves are damaged, the muscles in your foot lose their tone and stop holding the bones in place. The bones can actually shift or even fracture without you feeling it. Think of a suspension bridge. The cables are the nerves and tendons. If the cables snap, the bridge deck starts to sag and warp. You can't fix the bridge by just repainting it. You have to fix the cables. The ADA warns that Charcot foot is one of the most serious complications of diabetes. Compare your feet. Put them side by side. Is one wider? Is one redder? Is one toe suddenly leaning on another? Use your hands to feel the temperature. Is one foot significantly warmer than the other? Heat is a sign of internal bone inflammation. Number 7 is the yellow nail. People think, "I probably picked something up at the gym shower. It's just an appearance issue. But fungus loves sugar. When your blood sugar is high, your sweat and even your skin cells contain more glucose. You are literally feeding the fungus from the inside out. Furthermore, your immune system is too sluggish to fight the infection. It's like leaving a bowl of sugar water on your porch. You're going to attract every ant and fly in the neighborhood. A fungal nail is a sign that your body's porch is covered in sugar. Studies show that diabetics are nearly 3 times more likely to have nail fungus than non-diabetics. Inspect your nails after every shower. If you see yellowing, don't just paint over it with polish. Use a tea tree oil drop as a natural antiseptic, but more importantly, check your fasting blood sugar the next morning. The 8th sign is the ice block. Feet that are cold, even under a heavy blanket. Patients say, "I've always had poor circulation." In reality, this is microvascular disease. High sugar acts like shards of glass in your smallest vessels, scarring them and narrowing the path for blood. If blood can't get to your toes, heat can't get to your toes. Imagine a radiator in an old house. If the pipes are filled with sludge, the radiator stays cold no matter how high you turn up the furnace. Putting on socks is like putting a sweater on a cold radiator. It won't help if the hot water isn't flowing. The CDC notes that smokers with diabetes are at a 10 times higher risk for this type of circulatory failure. Try the capillary refill test. Press down on your big toenail until it turns white. Let go. It should turn pink again in less than 2 seconds. If it takes longer, the sludge is winning. Finally, sign number 9 is the electric jolt. A sudden, sharp zap of pain that comes out of nowhere. People think, "I must have just tweaked a muscle." This is the final warning. This is neuropathic lightning. Your nerves are so damaged, they are short-circuiting. It's often a sign that the damage is moving from the small fibers to the large fibers. It's like a power transformer on a pole during a storm. Everything seems fine, then suddenly, bam! A blue flash and a pop. Your nervous system is blowing a fuse. The Mayo Clinic classifies this as severe peripheral neuropathy, and it is often the stage where the risk of silent heart attacks increases, because if you can't feel the pain in your feet, you might not feel the pain in your chest. Walk barefoot on a rug. If that texture feels like sandpaper or causes zaps, your nerves are in crisis. Switch to a low-carb, Mediterranean-style diet today. Not tomorrow, today. Listen to me. I've seen too many good men and women lose their mobility, lose their independence, because they waited for a standard blood test to tell them they were sick. Your feet are the early warning system of your body. They are the canaries in the coal mine. If you have 2 or more of these signs, don't panic, but do act. Ask your doctor for an A1C test and a full neurological foot exam. Don't let them brush you off. Say, "Dr. Hayes told me to check this." You have the power to reverse this. You have the power to heal. But you have to stop making excuses for your symptoms. If you found this helpful, share this video with one friend. Just one. You might be the reason they keep their feet. I'm Dr. Arthur Hayes. Take care of your feet, and they'll take you wherever you want to go. I'll see you in the comments.